I am a MD Medicine and a diabetologist working in American Spine and Medical Institute, Ludhiana. I'm the director of the hospital and also the head of medicine department. I have about 10 years of experience in the field of internal medicine post my post graduation. I'm a pass out of Government College, Ahmedabad. Today we are going to we just had World Hypertension Day on the 17th of May last month. So we are going to talk this time about hypertension. What is hypertension? Basically what it means in layman language, what are the cutoffs, what can we do about it, and a little about the medication. So talking about hypertension, basically each time the heart beats, it pumps blood out from the heart into the blood vessels. That pressure that gets generated in the blood vessels on its wall is known as blood pressure. And when the pressure rises, it is known as hypertension. When the pressure rises more than 140 of systolic or 90 diastolic, it is known as hypertension. High blood pressure usually develops over the time. We come across many patients who don't even know they have hypertension or high BP. They are so used to it. The only way to measure blood pressure is to measure the blood pressure through a BP machine or a sphygmanometer. Symptoms are not essential, as many patients come to us who say they do not feel any blood pressure. They are actually the worst cases of hypertension as they are used to it. Hypertension, now why does it happen? Number one, family history plays a great role, genetic factors, apart from environmental factors like unhealthy lifestyle, too much stress, bad food habits, too much salt, fatty food, outside food, unhealthy food, fast food, less exercise or no exercise, 9 to 5 sitting jobs, they all play an important role in causing hypertension. So genetic and environmental factors. Age, as we talk about age, as the age increases, the chances of having blood pressure increase because your arteries, the vessels, they stiffen up, they calcify, so they're bound to have more pressure, hence blood pressure increases. Then family history, one or more family members having blood pressure, more the chances the next generations will have high blood pressure. Excess salt intake. Now we usually say to our patients, salt should not exceed 2 to 3 grams per day. So increase salt intake, more of pickled foods, jams, breads, bakery, biscuits, spices, more of fermented foods. They are all very high in salt content and hence cause blood pressure. Eating other processed foods, fatty foods, cheese, they're all full of salt, causes high blood pressure. Sedentary lifestyle, office jobs, they're again responsible in long term along with stress to cause hypertension. Moving on, hypertension does not have any obvious signs and symptoms. So this is why we always call it as a silent killer, which it is. So it puts people at risk of various different diseases such as heart ailments, like patient can be over the time develop LVH and they are more prone to, they have dyspnea and they can have a cardiac issue, they can have angina. Apart from that, they're more prone for CVAs, strokes, more prone for renal nephropathy, kidney nephropathy, hypertensive nephropathy, what it is called. Over the time, protein starts leaking into the urine and the blood pressure has to be taken care of. And the only way to do that is to measure blood pressure. Generally, the symptoms when they occur, usually they are headaches. Headache can be in the frontal or even in the occipital portion, morning headaches. The vision can be blurry, there can be buzzing in the ear, or few patients complain of feeling nauseous. Few patients even complain of having chest pain. It's long-standing because of severe concentric LVH or left ventricular hypertrophy. Some patients just say they don't feel all right, they feel fatigued, they feel nauseous, they have vomiting. So if a person is experiencing any of such problems, the blood pressure should be monitored. In fact, in most of the hospitals, it's protocol. If a patient comes to an OPD for any branch, usually we first take a reading. Fortunately, high blood pressure can be early diagnosed. So frequently, we should keep on checking more so if there is a family history, so that before it develops the complications, we can accurately treat it, bring it within range. It's usually measured with the instrument known as sphygmomanometer. A blood pressure is recorded in two numbers, which is known as systolic and diastolic, यानी कि ऊपर का BP and नीचे का BP, what people usually say. Systolic BP can be done by the palpable method, अपनी pulse को पकड़ के, but diastolic reading can only be taken with a stethoscope. So if any local practitioner or RMP or in the village, the reading is being taken by just palpating the pulse and is giving a reading of 150 by 80, it is not correct. You cannot measure the diastolic blood pressure without using your stethoscope. A healthy or normal blood pressure should be lower than 120/80, or it can, or it can be lower than that. Usually it comes, the readings are taken in the supine position, should be lower than 120 or 130. The upper number indicates systolic blood pressure. That means the blood pressure in the vessels when the heart is pumping, contracting. And the diastolic, the lower BP, 80, that is, indicates diastolic blood pressure. That is the BP recording when the blood is, when the vessels basically, that is the lower number diastolic, which means the pressure in the blood vessels when the heart rests, when it is in the resting phase between the two pumps. So that's the diastolic blood pressure. Now, when do you call it is hypertension? When the blood pressure is more than 140 by 90, it is known as hypertension. And that patient may be at risk of developing some serious ailments. Just last month on May 17, we celebrated World Hypertension Day. That is dedicated for highlighting the importance of hypertension, how to check it, how to control it, what are the signs, what are the symptoms. So measure your blood pressure, control it, and live longer. Ensure that your BP is measured and controlled whenever it is elevated. Usually we see amongst our patients, they get afraid of starting medications. Whenever they have a reading of blood pressure, on the first reading, usually as physicians, we also do not start until and unless it is very, very high. Patients, they're having repeated readings, high blood pressure, still the young ones, especially, they do not want to start with medication कि हमें हमेशा के लिए लग जाएगी. So we as doctors have to counsel them. वो एक medicine आपको बचाएगी कल को 5 और रोग होने से. So controlling your blood pressure is very, very important. If the BP keeps on, is in the higher state of more than 140 or more than 90 over the time, it's going to cause stiffness of the arteries. It's going to cause hypertrophy of the heart. So it's going to increase the rate of cardiac arrest, CVA, or renal problems. So what can we do, first of all, before starting medication to reduce our blood pressure? To reduce our blood pressure, first of all, increase exercise, start exercising. 30 minutes a day for at least 5 days in a week, we should exercise. Any aerobic exercises, walking, jogging, or weight training, swimming, yoga, power yoga, they are all very useful exercises. Second, if you are overweight, if your BMI is more than 25, or if you're morbid obese, your BMI is more than 30, you need to work hard to reduce your BMI. Usually lifestyle changes like exercise and a change in food and diet will help you reduce the weight. Otherwise, you can talk to your physician, take help of certain medications which are available. If you're morbidly obese, diabetic as well, and facing life to, daily, day-to-day activity problems, you can also consider for many bariatric options available these days, or other options minimally invasive like a endoscopic ballooning. So reduce your weight, bring your BMI like below 27 at least, and you will see all these things return to back to normal without medication. So next, reduce salt, most important. Reduce salt in your diet, reduce fatty food, reduce canned food, fermented food, fast food. Do not treat yourself more than once in a week. That too, think before ordering your food. As simple things like, you're eating a salad, do not sprinkle more salt on it. You're having a glass of juice, do not put any masala or any salt in it. So reducing that minimum quantities of salts here and there can reduce the blood pressure actually significantly. Apart from that, stress management. These days, stress management is very, very important. You can go into yoga or take help of counselors or psychiatrists if needed. Reduce stress, sleep, another important part. Your sleep should be good 6 to 8 hours of sleep. It is very important. Again, these things, even in diabetes, play a great role. And regular blood pressure monitoring. I also, once your blood pressure is controlled, then do not check too much frequently. That will just going to stress you and the BP readings will fluctuate. So till you are chasing your blood pressure, it is set, the doctor has set your medicine, great. After that, I always ask my patients, do not keep it checking. Check it like once or twice in a week at different times, but daily checking it 3 times in a day, not in the right way, just rushing from the office and sitting and just checking will not give appropriate readings. So in a relaxed position, lying down position, once in a week, twice in a week, it is enough. Or if you feel there is some problem, your body is feeling low or you're having too much headache or something is off, then take a reading. So regular exercise, talking a little in details about the what points we should undertake. As I said, regular exercise can be a drug-free approach to lower the blood pressure that will make the person's heart stronger rather. So lose weight, daily exercise, healthy diet. Again, I've covered this. You can follow different fancy diet regimens are very much available these days. Limit the amount of sodium in the diet. And smoking, again, smoking is a very important factor. Smoking increases blood pressure. So stopping smoking only can reduce the blood pressure to normal. So quit smoking. This can effectively reduce the risk of your heart. Not just it will reduce the blood pressure and the other serious risk factor it is for the lung cancer as well. So regular monitoring. We can buy a normal instrument at our home rather than depending upon every office visit to the doctor. So self-monitoring the blood pressure helps patient to take the BP readings at the ease of their home at different timings. Stress management, we should learn how to relax and manage stress emotionally and physically. We should stress free ourselves, our mind and our body, and automatically the blood pressure readings and other risk factors will get controlled. And last and most important, if you are put on some medication, please be adherent to the medication. So what I commonly see in the OPD is once the blood pressure comes to normal, suppose patient मैंने कहा दवाई ले रहे हैं बीपी मैंने कहा आप फॉलो अप में आए कहते हमने बीपी की गोली बंद कर दी आई सी द ब्लड प्रेशर इट्स 170 पेशेंट कहता बंद कर दी क्योंकि बीपी ठीक आ रहा था सो वो ठीक इसीलिए आ रहा था क्योंकि आप मेडिकेशन ले रही हो वो कहते हैं आपको वो छोड़ने के तीसरे दिन तक भी ठीक आ रहा था I make them understand usually the medications these days we are giving ARBs or ARNIs or ACE inhibitors their action stays up to 48 hours or even up to 3 days. So, then the rebound will come in a week or so. So we have to counsel our patient, do not stop your medication. We have to reduce the dose in case the blood pressure is going less than 110 or less than 60, or if you're feeling dizzy, especially now when this bad summer weather has come and humidity is getting high, so water loss is high. So the dose reduction will occur, but do not, you are on a combination of 3 medications and suddenly you stop the medicine thinking your BP is normal now. That's not going to happen. So we have to step by step titrate and lower the dose. Okay, so we've covered different lifestyle and Medicaid. Now we will talk a little about medications. So usually we titrate the medication of the patient. We customize the prescription. There is nothing fixed BP medicine for any patient. Looking at the background, if the patient is having kidney problem, heart problem along, or any other, has a neurological deficit or a patient. So patient's prescription is always customized. Usually when a patient of hypertension comes to me, I recommend some basic tests like an ECG should be done to rule out any LV strain or LVH or any other cardiac changes. Second, we should also always see for a urine routine at least, or if the patient is affordable, can look for albumin creatinine ratio. Apart from that, you can do just a creatinine maybe to see if there is any kind of side effect of blood pressure has already come on the kidneys or the heart. Apart from that, always get an eye checkup done by ophthalmologist. A fundus should be done for the changes, hypertensive retinopathy. Then, if everything is normal and the patient is non-diabetic, no kidney problem or no other problem, then we can start with any of the medication, usually a ACE inhibitor or a ARB or a ARNI or a CCB. If the patient is older age and the diastolic blood pressure is disproportionately higher, we can add a diuretic. Then if the patient, then if the you can always, after starting one drug, if it's not getting achieved, we add a combination with two different group family of drugs. Then we can add the third salt. And if it's needed, we can then keep on adding like a beta blocker, or we're looking at the pulse rate, or we can add some central agent, alpha or beta agonist. We keep on adding that ways. So we have to bring the blood pressure lesser than 140 and less than 90 diastolic, and keep on titrating. And along with good lifestyle management and exercise, usually the blood pressure will come in range within about 3 to 4 days or maximum a week. Unlike olden days, when you used to put like salts like nifedipines and atenolol, and suddenly the blood pressure was within control in 8 to 10 hours. We have to make the patient understand now these medicines will take their own time, and usually it takes 2 to 3 days for the blood pressure to settle down and the blood pressure is maintained. So regular office visits are very important. Also get a fasting cholesterol or a lipid profile level done, so that if there is underlying another risk factor, you can do good for your patient. And the patient is affordable or has ever had any episode of angina, can get a TMT or a cardiac echocardiography done. Again, we will find out other something if it's missing, and we can take action or prevent any inevitable event if it's bound to happen. So apart from that, in diet, I always explain my patients low salt, more of uncooked and less of cooked food. If we take your plate and divide it into 3 portions, 50% should be just greens or salads. It should be uncooked. Rest, if we divide the rest half into 50%, that should be protein, dal, sabzi, and the rest should be anaj or carbohydrate. So more of greens, less of salt. You should have ample of salts. Drink lots of water until and unless contraindicated, in case you've developed some side effects of hypertension like on kidney or on heart and you're going into overload. Then it's exceptional case, otherwise have lots of water. Keep your blood pressure under check. Prevent the complications that occur because of this. It is as simple as that. Control your BP and things will be, you will be far more, your next 10 years or 20 years, you will not have any kind of complications. You can be by yourself. You won't be any dependent person in the family. So keep taking your blood pressure readings. Take care of yourself. Less salt, high exercise, more of greens, better lifestyle, more exercise, swimming. It's summers, you can swim, and just reduce your salt. Just reduce the packaged food. That should be the mantra for this hypertensive year. And if any doubts, you can let me know or contact me. Thank you.